Kelly Hansen, thanks so much for being here.
Thank you, Dan.
Anytime. So I want to primarily talk to you about funding cuts and the state's withholdings, but first I'd like you to explain what these county officials do in terms of mental health, substance abuse, and people with developmental disabilities. I feel like the public just may not know that counties have this role.
Oh, absolutely. So our organization in Albany is called the Conference of Local Mental Hygiene Directors. And what we do is we represent the county mental health commissioners in each of the 57 counties and the Department of Mental Hygiene in the city of New York. And so while their title says Commissioner of Mental Health, their responsibilities are much broader than that. So our commissioners are responsible for development, oversight, and planning for integrated services to adults and children in their communities who are affected by mental illness, substance use disorder, and developmental disabilities. So they have very much an oversight and systems perspective role in the county.
So some very important services for people in every county of the state. Last year, the state withheld 20% of state funding to counties, and that obviously affected your work. Some cuts may be coming down the road as well, depending on what the state gets from the federal government. First, tell me how you're doing in terms of the cuts and the funding. I know some of it's been restored, others are permanent. And tell me what those cuts down in the future would look like for you.
So your viewers know what this funding is it's funding from the state to the county to be able to implement all of those plans and the integrated services that I mentioned earlier. And so for 3 quarters so far, the county state aid dollars have been cut by 20% each quarter. And it's a withhold is what we've been advised in anticipation of, based on activity from Washington, if that funding would be able to be restored. But that funding provides a lot of support and services in the community. For example, it pays for crisis services, pays for mobile crisis teams, pays for Narcan kits, it pays for recovery programs in the schools, it pays for care management for youth and young people who are struggling with addiction and mental health needs. So, the first quarter that was cut, our members are county officials. They're very good at cobbling together to see what you could do where whatever action you took would not impact direct services to their communities. Housing was funded at 100%, which is fantastic. Housing is so critical for our folks. And now we are all anticipating that we get some good news from Washington, because those services I mentioned before could be in jeopardy if, in fact, Washington doesn't come through. So we're very much hoping that $15 billion will be coming through from the feds back to New York.
You mentioned crisis services, and the governor has a really interesting proposal this year to set up these crisis stabilization centers around the state. So what these centers would be, basically, would be 24/7 places where people who are experiencing a mental health crisis or a substance abuse crisis could go and receive services and treatment. I'm wondering, because this brought up the question for me, what do people do now when they're in crisis, and what do you think of the governor's idea?
Right. Right now, if someone is in crisis, they can contact a crisis line. They can contact a suicide hotline. And we have crisis teams, mobile crisis teams. Not every county has them, but that can triage and make a decision as to being able to, address it in person. We also, people also will call 911. In many counties, there's a connection with mobile crisis if you need mobile crisis to go out at the same time, if they're available. So, but a model that seems to be appearing in the governor's bill that has been established in many parts of the country is called a crisis stabilization center. And we've had, in Dutchess County, has had a crisis stabilization center for several years now. And essentially what it does is it creates a location for individuals who are experiencing mental illness issues at a higher level, having substance use issues, to actually go to that location and be stabilized. So under the governor's bill, some of the services would be, engagement, telehealth would be there, OASIS license, there would be, mild to moderate withdrawal assistance. They would have to have psychiatry, nurse practitioners or psychiatrists. And as I mentioned before, peers. Peers are individuals with lived experience, and their skills are incredible in terms of being able to engage people. But I think part of putting the bill in place was necessary for a couple of reasons. When Duchess first started, one of the big questions was, how do we license this entity? It's different from anything we've seen, and the bill would move toward that end, and then also ultimately, hopefully, be able to access perhaps some Medicaid reimbursement.
Speaking of Medicaid, the governor has a proposal this year to expand telehealth, and I was surprised to learn that Medicaid recipients don't have the same access to telehealth as people who have private insurance. Can you briefly explain what the governor is trying to do here, and do you think it goes far enough?
Sure. And I think, the commercial world has been further ahead on telehealth, I think, than the Medicaid world. But with COVID, if there's any silver lining in COVID, it showed how much telehealth improved the ability to be able to reach folks and access folks. So when the governor's executive orders, it relaxed all of those other requirements that you have to see a face-to-face. You can only do video only, not phone only. Who can bill for providing telehealth? So what the governor has done, my understanding of the bill is that it's been a very comprehensive approach across all types of entities, because behavioral health wasn't the only one. But we were, some of the best things that have come out of that is, increased access to services, to care. So traditionally, there's a relatively high no-show rate for appointments for clinic services, therapy services, et cetera. And our members and others were saying that those no-show rates went down significantly. People were not missing appointments. They were engaged in care. It was also, sometimes helpful for the clinician to talk with the individual. You could see their surroundings. You could see how is their house looking? How are they doing? So there have been a lot of benefits. We were concerned that it would expire, and we're happy to see that this will continue, and that it makes a huge difference in terms of access to services. Again, when the need is just going through the roof, and it will be lasting need for services.
All right, Kelly Handsome from the New York State Conference of Local Mental Hygiene Directors. Thanks so much for being here.
Thank you, Dan.